This presentation is on visual impairment health concerns. The Snellen chart is a tool used in testing visual acuity. The test begins by placing the person 20 feet or 6 meters from the chart. The objective of the test is to determine the smallest letters one can read on the chart while standing 20 feet away. If the person has healthy eyes, they have what we call 20/20 vision. 20/20 vision means they can see the letters from 20 feet away. If one scores, for example, 20/40, this means they see at 20 feet what a normal healthy eye can see at 40 feet. The American Foundation for the Blind defines low vision as uncorrectable vision loss that interferes with daily activities. Low vision is often characterized among professionals as reduced vision that cannot be corrected with regular glasses, contact lenses, medicine, or surgery. The American Foundation for the Blind defines legal blindness as a visual acuity of 20/200 or less in the better seeing eye with best conventional correction, meaning with regular glasses or contact lenses. This is based on the results using the Snellen chart mentioned above. Statewide, nearly 50,000 people in Utah are blind or visually impaired. Nationally, more than 34 million Americans are visually impaired or blind. Internationally, nearly 1.3 billion people live with some form of visual impairment, and 36 million are legally blind. According to the World Health Organization, 90% of people with visual impairments live in low to middle class households. With this being said, many of the people who suffer with visual impairments do not have the healthcare access and financial means for quality education and corrective treatments. Healthy People 2020's goal is to create social and physical environments that promote good health for all. Examples of social determinants of health are healthcare, social and community context, education, economic stability, and neighborhood environment. Lack of healthcare, physical obstacles, and lack of education create barriers for 90% of those with visual impairments. There are many concerns that disproportionately affect this population. Physical barriers, for example, are a result of increased danger when those with poor vision and or blindness are navigating around. An educational concern is not only the lack of healthcare access and therefore quality education from providers, but finding appropriate schools that cater to those with visual impairments. A psychosocial barrier is the lack of independence one with extreme visual impairment/blindness might experience. According to the World Health Organization, globally the leading cause of vision impairment are incorrected refractive errors and cataracts. The World Health Organization also suggests that 80% of all visual impairment is avoidable, and the majority of those with visual impairment are over 50 years old. According to the Center for Disease Control, the leading cause of blindness and low vision in the United States are primarily age-related eye diseases such as age-related macular degeneration, cataracts, diabetic retinopathy, and glaucoma. Those who suffer with visual impairments and blindness are vulnerable because everyday tasks are much more challenging when vision is impaired. Maslow's hierarchy of needs contains 5 levels of needs that eventually lead to self-actualization. If every tier is met, then self-actualization is possible. The 5 tiers include physiological, things like breathing, food, and water; safety, such as resources, health, security; love and belonging; friendship, family, and sexual intimacy; esteem, confidence; and finally self-actualization, which is summed up with morality, acceptance, and problem solving. In the United States especially, those who are blind or visually impaired most likely meet physiological needs of things like food and water. Safety needs, on the other hand, might not be met. Safety is a huge concern of those with loss of vision due to the increased risk of falls and harm to self. Depending on home life, love and belonging may or may not be met. Esteem and confidence could be deterred due to insecurities about being vulnerable and abnormal. Finally, if any of these tiers are unmet, self-actualization will not be met either. Functional level of this population depends on the resources one has. There are corrective surgeries to help with those who fall in a low vision impairment category. Of course, to obtain these treatments, one would need access to healthcare and the financial means to pay for the treatment. The functional level of a visually impaired individual without healthcare and the family support system to help navigate through daily challenges would be extremely low. Likely health outcomes also depend on the resources one has connections to. Communicable diseases are infections that are spread from one person to another through ways such as contact with bodily fluids, insect bites, or breathing in a virus. Examples include tuberculosis, influenza, and hepatitis. Non-communicable diseases are non-infectious and non-transmissible. These diseases are either genetic or behavioral. Examples include cardiovascular disease, diabetes, Alzheimer's. Those with visual impairments are not physiologically at risk for communicable or non-communicable diseases. Those with lack of healthcare and proper education, on the other hand, are at an increased risk. Since 90% of visually impaired people fall into a low to middle class family, they could indirectly be at a higher risk for infections. Prevention includes increased awareness / education, vaccines, and access to healthcare. Those with visual impairments and blindness could be at a higher risk for self-care deficits / self-harm. It is challenging to navigate and perform basic activities of daily living without the ability to see. Loss of vision, especially in an older population, can lead to inability to complete things such as showers and dressings. Those who are legally blind are also unable to legally drive. This makes these men and women very dependent on help from family and friends. Self-harm can also be increased in those with low vision and blindness. For example, if something in the house has been moved from its normal spot, this person could easily trip and fall. There's also been studies that show an increased risk for traffic injuries and occupational injuries. Proper education and evaluation is important in teaching those with visual impairments how to perform activities of daily living and function as closely to those with healthy vision. Many resources are available for this population to help learn things like reading with Braille, navigating through a store, as well as providing support groups. Those in this population have an increased risk of falls. This not only harms the visually impaired person, but anyone in their surroundings. Decreasing risk of harm can be done through offering education classes regarding safety tips and risk factors for those with decreased vision. And here are my references. Thank you.